Very interesting. Okay, so we're talking about the surge we're kind of having right now, and then there's rumors that okay, if we combine COVID with the flu, we might be looking at a surge in the fall. So how is Kaweah Delta doing with our PPE supplies?
Yeah, well, certainly better than we were at the beginning, but far better, far better. So I actually get a daily report that comes out of our materials management department and all the different types of PPE. So N95 masks right at 110,000, which under normal circumstances would actually be about 5 years worth, frankly. I mean, I think it's 1,900 days. So divide that by 365. I don't know if my math was right there, but just again, pre-COVID, it was rare that people would wear N95 masks. Generally, if you're treating patients with tuberculosis or measles or some type of virus or disease that's transmitted through the air, is when you'd wear an N95 mask. So that'd be normal conditions. We're still right now. We're giving more and more N95 masks. Anybody that's going to be put in a position where they could be exposed to an aerolized. So if you're doing a breathing treatment or you're going to spend a prolonged amount of time in the room. So definitely our nurses, our CNAs, therapists, anybody that's working on 2 South, they're wearing an N95 mask all day long, and they're getting a brand new one every single day at the start of the shift. Before, we were having them reuse them.
Right.
But as supplies have got more plentiful, we're now giving them. Now we're talking about, are we going to get to the point where we can give them a brand new one every time they go in and out of a patient room? So we do that now with surgical masks. So those employees that don't have to wear an N95, they literally put on a brand new surgical mask every time they go into the room, and they throw it away when they come out. We definitely weren't doing that in the early stages of it. But we now have 290,000 surgical masks on hand, which again, under normal circumstances, that would be about 230 days worth. So we are continuing to order. And surgical masks are coming in pretty routinely now. N95 masks, particularly the 3M N95 masks, which is what we want to use and what we've always used, those are still difficult to acquire. We're still getting them, but not routinely. But then there's so many other N95 or KN95s that are not safe or do not fit well. So we're kind of particular when it comes to the N95 masks. And that's where we kind of made a plea to the community and the public,
Right.
too. I see so many people out there wearing N95 masks in the grocery stores. And, unless you've been fit tested for an N95 mask, it's providing you no additional protection than what you'd get from a surgical mask or a cloth mask. So if you're wearing it for that reason, you don't need to wear an N95 mask. Save that for the healthcare workers on the front line. So,
Right.
Gloves, 70,000. Face shields, more than 5,000. Goggles, glasses, almost 1,800. Isolation gowns has been probably our biggest challenge. And I'm looking at the number. I'm shocked and very pleased. We now have 32,000. Just about a week ago, we were down to 7,000. So
Yeah.
somehow Steve Bajari must have landed.
Yeah, we got a big shipment the
yeah,
other
must
day.
have.
Yeah.
Because we use those pretty extensively. When you're going into the room, and again, this disease is primarily transmitted by micro droplets and stuff. You want somebody, wearing
Right.
these gowns to protect them. So really glad to see that. But as I've talked in the past, we generally have been a just-in-time hospital, as most all hospitals are. You order supplies, you don't warehouse them. Some do expire, but you just don't need to keep a lot on hand because the supply channels are just so solid, stable and everything. But we see what happens in a pandemic. So hospitals are now definitely stocking up. We're looking for warehouse space where we could actually create, PPE inventories that would prepare us in the event of a new pandemic or if we see a resurgence in this one. And it actually is one of the requirements of the governor. To be
Okay.
able to fully open up the economy, hospitals have to be able to demonstrate that they've got sufficient PPE to take them much further than they were before.
Mhm.